Hello, everyone. This is Dr. Annie Wu. I'm a neurology and a neuromuscular medicine specialist, and it's my honor to be here with you today to talk about lupus, cognitive function, and the nerve-related issues. I particularly want to thank Eliza for her invitation and all the help she provided for this seminar. And of course, it's a Saturday noon, 12 o'clock. I specifically set my background for the beach and the ocean. So I'm sure, you are enjoying beach and ocean in the summertime, but today you are here with me. So let's just put the ocean and the sunlight in our mind and focus on this talk today. 嗨，大家好，你们好，我是那个武安利医生，我是脑神经内科和神经肌肉专科的医生。今天很高兴在这里给大家做一个公益讲座，讲讲红斑狼疮和认知功能及神经损痛。因为今天是星期六，大家应该都去沙滩啊玩啊，去看大海。但是呢，因为你们在这里，和我共享这1个小时的时光，所以我特别的把我的那个 background set up，作为一个大海和阳光，大家在 background 可以享受。但是现在呢，我们先开始我们正常的那个讲座了，希望大家能够喜欢。So here's a disclaimer. So the information presented in this material is intended for educational and informational purpose only. It's not a substitute for professional medical advice, diagnosis, or treatment. 现在呢，我们先声明一下，这个文稿呢所提供的信息呢，仅用于教育和参考的目的，不能替代专业医疗的建议、诊断或治疗。下面我们开始我们的第一个 slides. So I'm sure everybody knows lupus here. All the audience probably know something about lupus. Actually, I have a question first. Do you know how many lupus patients in United States? I invite you to type in the chat for your answer. Let's see how many can get it right. So the first question here is, how many lupus patients in United States? 所以呢，我现在想问大家一个问题，考大家，大家猜一猜，在美国，我们有多少那个红斑狼疮的病人？希望大家踊跃的在 chat 里面，type 里的 answer。我已经看见有些人说30万，有些人说 too many，30万 is too low。所以呢，大家要向高一点的猜，30万太少了。300,000 is too low for lupus patients. 1 million. Okay, we got somebody. Oh God, who got 1.5? Very good. Excellent. Yes, we have 1.5 million lupus patients in United States. But actually, we have 340 million people in the States. So lupus is actually not a very common disease, but we cannot say it's rare either. So basically 1 person in 2,000 people, there will be a lupus patient. So thanks for your responding. Excellent. 1.5 million. Okay, lupus basically it's autoimmune disease. So what's autoimmune disease? So its immune system mistakenly attack its own tissue that cause inflammation and damage. So commonly it's in women and it's between 15 to 44 years old. So it's a young and middle-aged people disease. And they affect a lot of body systems, including the skin, the joints, the nervous system, the kidneys, the lung, heart, and blood. Give me a second. Sorry, I have to close the door. All right, so let me speak this in Chinese. 所以呢，红斑狼疮呢会影响身体很多不同的系统。首先，红斑狼疮这个疾病呢是一个自身的免疫性疾病，它就是我们自己的免疫系统去攻击自己的组织，所以导致的发炎和损伤。 这个病呢，最常见呢是在15至44岁之间的女性，它会引起多个神经系统，包括我们的皮肤，比如说出现皮疹，我们的关节会引起疼痛及僵硬，神经系统呢会引起认知的功能神经病变，还有其他的神经系统的问题。肾脏呢，很多常见的是引发肾炎，肺部呢可能会导致呼吸困难，心脏呢可能会引起心脏病，或者是心脏的衰竭，血液呢可能会引起贫血。所以现在我要问大家第二个问题。So here comes the second question. Please type your answer in the chat. 请大家在 chat 里面写你的答案。第二个问题是，我们说 lupus 就是红斑狼疮是女性多，那么大家觉得女性和男性的比例在什么程度呢？就是说有多少个女性，比如说100分是总分，那么有多少是女性，多少是男性，或者你可以直接 type 10个是总分，那么是多少？5:4、5:5、6:4，就说你 type 一下你的 answer. So here I want everybody to participate to type your answer in the chat. My question is, what do you think the ratio between women and men for lupus? Someone said 75% female. Pretty good. Anybody else wants to take a guess? Wow. Very good. 9-1. Perfect. Yeah, so basically you have 90% women and only 10% of men. Who typed 10-1? Okay, that's a very good answer if it's possible. All right, let's move on. So here I want to show everybody. Okay, so here's the image, more intuitive for your review. So we know lupus can affect our nervous system, eyes, your mouth, your skin, your heart, your kidney, your GI system, even reproductive system, and hematological, musculoskeletal. 所以呢，这个比较直观的，大家可以看一下，红斑狼疮可以影响我们的神经系统、中枢神经系统，其实也可以影响我们的那个周围神经系统，眼睛、口腔、皮肤、心肺、肾脏、肠胃、生殖系统、血液系统，肌肉骨骼，通常是最常见的。就是说肌肉骨骼的话，就是很多病痛。这个经常很多的 lupus 病人都会抱怨这个问题，但实际上并不是最严重的，最严重的要是肾脏还有那个心脏系统的毛病，那个会更加严重。Okay, since I'm a neurologist, I'm not going to talk too much about the other systems today because lupus is actually an autoimmune disease and it's a specialist by a rheumatologist. So they probably know all the other systems much better. Today, my talk is going to be focused on the cognitive function. So the lupus cognitive dysfunction is actually common. From 15 to 80% of lupus patients will have the cognitive dysfunction. The exact cause, we are not sure. It's really still unclear. But basically, it's a blood-brain barrier disruption. So we know in order for the system get into the brain, we have a barrier called the blood-brain barrier. So once they're disrupted, so the things in your blood can go to your brain. Some of them should not go in there. For example, the neurotoxic autoantibodies, they can go into the CNS, which they should be prevented by the barrier not to go in. So that could cause the dysfunction. So the second one, let's talk about what kind of memory impairment we're going to notice for the cognitive dysfunction in lupus. So first of all, very easy, difficult to remember. So you feel like your memory is not that good. You used to be able to remember a lot of things. Now you feel like it's hard for you to remember things. The second, the attention and the concentration deficit. So basically you have difficult to stay focused on tasks, or like you used to be able to multitask. Now you find it's very difficult to do that. And you are easily to be distracted. We also have mental slowing. Basically, it's kind of take you a while for you to react to something you could or you should react faster. And executive function, basically this involves with difficult with planning, organization, time management, and problem solving. And also word finding difficulties. So sometimes you will have trouble to retrieve the right words. You want to express something, then you find difficulty. Oh God, I don't know what should I say. It's, in my head, but I just cannot get it out. So that's word find difficulties. 所以呢，红斑狼疮呢相关的认知功能的障碍呢，实际上是比较常见的，有15%到80%的红斑狼疮的病人都可能有认知功能的障碍。确切的原因呢不是很清楚，但是可能呢与我们的血脑屏障受损有关，因为这个血脑屏障呢是很重要的，它是防止我们血液里的一些东西不应该进入中枢神经系统的东西进入大脑。但是当这个屏障受到损伤的时候呢，有一些神经毒素的自身抗体呢就能够进入我们的大脑，进入我们的中枢神经系统，所以引起问题。那么我们常见的一些认知功能的障碍有些什么呢？首先呢就是记忆方面的，比如说你会发现你比较难记住事情，比如说你以前觉得我这个很容易就记住了，现在我好像要花很多的时间和精力才能记住。第二件事情呢就是注意力和专注力的缺陷。这个呢，就是比如说你在做什么事情的时候，你觉得你集中不了精神，容易分心。然后呢，比如说你以前你可以同时做几件事情，现在你发现能够同时做几件事情，这个太难了，就是很难了。这就是注意力和专注力的问题，还会影响我们的思维的迟缓。通常我们对一些事物的思考和反应是比较快的。当你出现了认知功能障碍的时候呢，你可能觉得你要花很长的时间才能够反映一个比较简单的问题。还有呢，就是执行功能的障碍，比如说在计划呀、组织啊、时间管理和解决问题的方面有一些困难。词语提取的困难呢，就是说你有的时候很难找到合适的词语来表达。Okay, next we're going to talk about the diagnosis. So basically, to diagnose the cognitive dysfunction, we have a neuropsychological testing. This is actually a very comprehensive testing. They can test your memory, your attention, your processing speed, and the executive functions. So there are actually many kinds of neuropsychological testing. Some will be more comprehensive, some will be easier. So usually, if you need a diagnosis, you need to get the test. You have to find, specific center to do such thing. The other thing that's very helpful for the diagnosis will be neuroimaging. So there are many, many neuroimaging types can be helpful. But the major two I'm going to talk about today is a conventional structure MRI. Basically, it's the MRI of the brain, your doctor usually refers you the very basic. So that one can show the structure. For example, the hippocampus. We know the hippocampus is very important, critical structure in the brain for your memory formation. So with lupus cognitive dysfunction, the MRI could show the lower hippocampal volume. But if the hippocampal volume is normal, does not mean you do not have cognitive dysfunction in lupus patient. So this, everybody should understand that. It's helpful if it shows, but it does not exclude the diagnosis when the MRI does not show. So the second one is a functional MRI. This is more like modern technology. So it can show a disturbance to the anatomic areas corresponding to the working memory and the executive function. So this is more like detailed in function. 下面我们讲的呢是怎么样诊断这个红斑狼疮的那个记忆的问题。通常呢，我们有2个方法，一个呢是神经心理学的评估，这个评估呢是非常具体和全面的，它可以评估记忆力、注意力、处理事物的速度和执行的功能。这个评估呢，实际上有很多种版本，有些版本呢更加具体，更加的多元化，有些版本呢比较简单。所以，你如果需要做这么一个评估的话，需要跟你的医生专门去讲这么一个需要，然后看什么样的哪一种的评估更适合你。第二个呢就是神经影像学的检查，这个部分呢其实现在已经有很多种神经影像学的检查了。但是呢，我这里主要讲一讲传统结构性的核磁共振。 这个呢，就是说它可以显示你的海马体积减少。海马体是我们人类就是对记忆方面形成合成的最重要的脑部的一个器官，所以如果海马体积减少的话，那么你的记忆力肯定会受到影响。但是在这里呢，需要提醒大家的是，你如果有这个认知功能的障碍，你的海马体积可能会减少。但是如果你的海马体积没有减少，并不表示你没有红斑狼疮引起的认知性的障碍。那么呢，有最新的一种呢，比较新的啊，就是功能性的核磁共振的影像。这个呢，就是它和功能相关的解剖区域可以跟你显示出来。那么可以发现你的工作记忆啊，或者执行功能呢，在特别的这个解剖区域出现功能障碍。So here I'm showing you the picture of neuroimaging. So you can see there are so many different. So this one is functional MRI on the top, and then you have PETs, and you have a DCE on the right, and you have your structural MRI imaging. 所以呢，这个是中文的显示一下神经的影像学我们可以运用的。第一个呢就是我们讲的功能性的核磁共振，然后左下方的呢就是结构性的核磁共振。当然这里还有显示其他的那个核磁共振的那个其他的影像，但是我们在这里就不具体讲这个了。Next one, we're going to talk about treatment. So treatment for the lupus cognitive dysfunction. So basically, as we can imagine, lupus is autoimmune disease. If you control the underlying autoimmune disease activities, you can definitely improve all the symptoms associated with it. So if you have a lupus flare, you need corticosteroids. Then by treating that, you may actually improve your function of your cognitive. And so the next one is cognitive rehabilitation. So basically, you can use some of the methods. Some of them are very easy. For example, you can use a memory aids. So you can make a list. For example, you go shopping, you can make a shopping list. You need to go to see doctors. You use your calendar to put them on. So those little memory aids can definitely help you with your cognitive function. And another thing is attention strategies. So basically, we talk about it's difficult to multitask. So why don't we focus on doing one task at a time? In this way, you can get things done instead of trying to do things at the same time and get nothing done. Refreezing. So this is a very important method to find alternative ways to express your thoughts. For example, if you want to talk about pen, but suddenly you cannot come with a simple word of pen. So what do? So you can say, oh, the thing we used to write, right? So you can always rephrasing if you have trouble to find a specific word. The next thing is lifestyle modifications. This include regular exercise and sleep hygiene. Sleep hygiene, I want to specifically talk about that because lupus, and actually you could have insomnia, which means you have sleeping difficulty. And insomnia can definitely make the cognitive function worse. So what can you do to improve your sleep? So the sleep hygiene includes some like very basic methods you probably don't even know, but it's very easy to do. First, you got to think about your bedroom is your bedroom. So only use your bedroom to sleep. Do not do writing, working, eating, reading in the bedroom. So, because you do those, then your bedroom is not a bedroom. So when you go back to bedroom, try to sleep, your body, your brain will respond as, oh, I can, still read here, I can still write here, I can still do other work. So the first thing is really make your bedroom as a place to sleep. Do not do anything else. Second of all is to set up a specific time to sleep. Some people, like to, oh, today I need to do something. I'm going to watch a movie or whatever. I'm going to sleep really late. And tomorrow I'm going to sleep earlier. This is actually not very good for sleep hygiene because you're changing, constantly, even every day. So it's hard for your brain to calm down at the time to sleep. So setting up a specific time to sleep is very important for your sleep hygiene. And also, drink a cup of warm milk, have a little warm foot bath. Those can all help with sleep hygiene. Another thing is you can always make your bedroom darker. So, when it's sleeping time, make sure it's dark and it's not always bright. So then your body will know, oh, this is dark, it's time to sleep, instead of it's bright all the time. So your brain will know when it's time for me to sleep. So next one is medications. So this is actually the part is in most of research. Currently, the cognitive dysfunction for lupus with medicine treatment, is still, really under research. I talk about two things here. Memantine, this is actually called Namenda. It's a very, very good medication for Alzheimer's disease, actually. But this can also help the other cognitive dysfunction. It's under research. Some of the data showing Namenda can help with lupus cognitive dysfunction. Some of the research did not show much, improvement. So this definitely, we need more data on this medication. ACE inhibitor, it's very interesting because if you know, ACE inhibitor is actually a hypertensive medication like lisinopril. It really helps hypertension and help to protect your kidney. So, but there are a few studies coming out saying ACE inhibitor actually can help lupus cognitive dysfunction. So how about Aricept? Aricept is another medication treating for Alzheimer's disease, but actually we do not have enough data, enough research for Aricept to treat for cognitive dysfunction. 所以呢，我们现在讲那个治疗的方案。那么，因为红斑狼疮呢，它这个疾病，如果在你这个疾病很活跃的时候，那么你其他的系统都会受到影响。所以呢，一个可以治疗你的认知问题的一个方法呢，就是你要把你潜在的红斑狼疮的这个疾病治好。比如说，你可以用那个 steroids， 这些就是专门治疗疾病的红疮狼疮的疾病的。那么也可以间接的帮助你在认知功能方面的障碍。然后呢，一些认知的康复训练，这个是非常有用的，可以改善你的认知功能的。首先呢，我们讲的是那个记忆辅助工具，比如说你可以列清单，如果你今天要去买菜，对不对？你列一张单子，我今天要买什么，那么你去的时候，根据这个单子，你就可以买完所有的东西，就是这样就可以帮助你的记忆力。还有呢，就是使用你的日历。比如说你哪天要去看医生，你记不住，你不用记啊，你就放在日历本上，这样的话也可以帮助你的记忆。然后呢，注意力的策略呢，我们提议你一次专注于做一件事情，所以你就专注于做一件事情，把它做好做完，而不是想同时去做几件事情。这样的话，你可以至少做完一件事，而不是在你同时做几件事的时候，一件也完不成。表达的重构这个方法是非常有用的，比如说你可以用不同的方式来表达自己的想法。比如说你有的时候突然忘记一个词，比如说我想说笔，但是我忘记笔这个词了，所以我可以说就是那个写字用的，那么就说大家都理解了，你也可以表达清楚了。所以这个表达重构呢，是生活当中可以经常用到的，当你一下子想不出那个你要用的词的时候。然后呢，生活方式的调整，规律的锻炼是非常重要的。我们在后期的那些slides 里面会讲更多的一些锻炼。然后呢，要保持良好的睡眠习惯，这个要给大家讲一下，因为 lupus 很多时候你的睡眠都不好，然后睡眠不好呢，又造成一个恶性循环，睡眠不好又会造成你的这个认知功能更差。那么有一些很简单的保持睡眠习惯的方式，其实大家是可以运用到的。比如说，大家要把你的卧室当做卧室来用，不建议大家在卧室里面去工作啊，去读书啊，去写东西啊，去吃东西啊，因为这样的话，就是说给你脑部造成一个混乱，就是我既然可以在这个卧室里面做这么多事情，那么睡觉的时候我为什么要睡觉呢？我可以去做其他的事情呢？所以当你只是用于睡觉的用的这个卧室的时候，那么你到了时候你睡觉，你一进到你的卧室里面，就有一个，就是说你的脑部就会提醒你，哦，我现在是该睡觉的时候了。所以这是一个大家可以用的一个方式。还有呢，就是要保持睡眠入睡的时间，这个很重要。不要说我今天熬夜，明天我提早睡，这样换来换去的话，就说对你睡眠会产生很大的影响。如果我每天说我10点钟睡觉，那么你就保持10点钟睡觉，这样你的入眠的话就会更快一些。还有呢，就是说你可以把你的卧室的，就是说窗帘 要设一下，就是说当你睡觉的时候，就是这个卧室的亮度是暗的，就说这样你提醒你的大脑，哦，我是时候睡觉了。如果你卧室的灯很亮，或者你没有窗帘，整天都很亮的话，那么你也不知道，你的大脑也不知道会提醒你，哎，我什么时候是该入睡了。还有呢，就说你可以睡前喝一杯牛奶呀，还有泡泡热水脚啊，这些其实对睡眠，如果你睡眠不好的话，对你的睡眠都会有很好的帮助。然后下面我们讲讲药物治疗。在那个红斑狼疮的这个认知的这个功能上面，其实目前的药物治疗还处于初期的试验阶段，还有很多的就是需要做的 research 正在做。我要提到的两个药物呢，一个是美金刚，这个呢实际上是治疗老年痴呆的一个很好的药物，但是呢，它对红斑狼疮引起的认知障碍呢，就是在一些study 里面显示出来也是有帮助的，但是另外一些显示出来呢也没有太大的帮助，所以这个还有待更多的 research。然后呢，我们讲的那个 ACE 抑制剂呢，这个实际上是一种控制高血压的药物，虽然它控制高血压，但是实际上它也可以保护我们的肾脏。所以呢，就说这个ACE inhibitor 这个抑制剂呢，对认知的功能在一些 study 里面显示出也有帮助，但是也是没有很多更多的那个 research 所以现在目前还在一个就是在一个那个 research 的阶段。那么还有另外一种药，也许我们大家都知道，叫做 Aricept， 也是治疗帕金森用的，是治疗那种比较轻微的帕金森。但是这个药呢，并没有很多 research 在做这方面的，所以在这个药方面的用法呢，目前是非常缺乏的，所以我们不能就说提示大家可以用，因为还没有足够的证据证明那个药对这个红斑狼疮引起的认知功能是有帮助的。Okay, now let's switch gear to the lupus neuropathy. So lupus can definitely cause nerve damage. That's a peripheral nervous system. So it's also relatively common. It's 5 to 60%, not as common as the cognitive dysfunction. So there are multifactorial causes. For example, the underlying vasculopathy. Vasculopathy basically means the disease of the blood vessel, which is the major cause of the lupus pathology we understand so far. So this can definitely cause neuropathy. And the systemic complications of lupus, for example, your renal failure, uremic neuropathy. So this toxin accumulation in the body due to kidney failure can also cause neuropathy. So in lupus, we actually have two major neuropathies. One is axonal neuropathy, one is demyelinating neuropathy. Axonal neuropathy, it's damaged the nerve fiber, so the axon itself. So this is more common. The demyelinating neuropathy, it's actually damaged the myelin sheath. Where's the myelin sheath? It's wrapping around the axons to protect the axons. So there are two major neuropathies in lupus. 所以呢，我们现在换一个讲讲红斑狼疮的神经的病变，这个通常是指周围神经系统的这种神经损伤呢，相对也是属于常见的，它有5%到60%，没有就是那个认知功能那么的常见，但是也是属于非常常见的了。那么引起这个神经病变的原因呢也很多，其中最重要的就是这个血管病变，因为血管病变呢会引起血管去滋润的那个神经的部分出现问题，所以会产生神经的病变。然后红斑狼疮的全身并发症呢，比如说你的肾衰竭和你的尿毒症引起的神经病变，这个就是因为你的肾脏功能受到影响，你的毒素在体内排不出去，那么也会引起神经的病变。在系统性红斑狼疮中呢，最常见的两种神经病变呢，一种是叫做竹突性的，一种是叫做脱水鞘性的。竹突性的呢，是指你影响的是神经纤维的本身，而脱水鞘性的呢，是影响这个包围着、保护着这个竹突的水鞘的受损。所以，这个水鞘的受损呢，没有这个竹突神经病变的常见。Next, I'm going to show you basically a simple neuron in the peripheral nervous system, the structure. So everybody can see the axon, which is the purple part. So the purple part is the whole neuron, and the yellow part, those are the myelin sheaths. You see, they wrap around the axons. So when we talk about axonal neuropathy, it's affecting the axon, the inside, the purple part. And when we talk about demyelinating neuropathy, we are talking about the involvement of the myelin sheaths. So the thing wrap around the axons. 这边呢，给大家显示一下一个中文的图，这个呢就是一个周边神经系统的神经元的结构的简化图。我们可以看到这个神经元的话，它当然有很多其他的东西，什么细胞核啊、树突啊，但是最主要的，我这里要显示给大家的是这个紫色的这个是猪突，这个是神经纤维的本身，所以这个引起呢是那个竹突的神经性的病变。然后呢，我们有看到这个黄色的，这个是水鞘。这个呢是包围着这个竹突的，是保护它的。那么这个水鞘受到损伤呢，就会引起水鞘型的神经病变。但是就像我说的，竹突型的神经病变呢，是在红斑狼疮的神经受损中更为常见。Okay, next we're going to talk about some common types of lupus neuropathy. So the most common, it's a slowly progressive sensory neuropathy. Why we call it sensory neuropathy? Because it only affects your sensories. So for example, you usually started to feel the numbness, the tingling beginning in the feet. And it's slowly progressive because it may just be little numbness and tingling in your feet for a few years. Then it's going to go up to part of your calves. And then after many years, it may go up to your knee. So basically, it's slowly progressive and it's only affect your sensory. This is the most common type of lupus neuropathy. The next type is a small fiber neuropathy. So small fiber neuropathy is a little different. They affecting the small fibers. So they usually present with burning sensation. Some people say, oh, my feet feel like so burning. It's like so hot. So that type is a small fiber neuropathy. The third one mentioned here is multiple mononeuropathies. So multiple mononeuropathies is affecting more different individual nerves in your system. For example, it can affect the nerve in your arms, in your hand, like a carpal tunnel syndrome. It can also affect the nerve in your legs, for example, the peroneal neuropathy. So they can present at the same time. So it's not like I just have carpal tunnel or I just have peroneal neuropathy. The patient may present both, together. Then the next one is a generalized symmetrical axonal sensory motor polyneuropathy. I know the term sounds a little bit complicated, but basically this just means this affects both your sensory and your motor nerves. Instead of the first most common one only affects sensory, this affects sensory and motor both. 所以呢，我们现在呢讲一讲这个红斑狼疮引起的神经病变的类型。最为常见的呢，就是一种缓慢进展的感知神经病变。这个呢，通常是从脚逐步开始的，比如说你脚趾头开始出现麻痹，然后到你的脚中央，或者再到你的脚颈。这个呢是最为常见的一种，它只影响你的感觉，不影响你的力量和运动。第二种呢是小纤维神经的病变，这种主要的症状呢是一种灼烧感，你会觉得好像我的脚热热的，整天都在发烫发烧，这种是小纤维神经的病变。还有呢就是多发性单神经的病变，就是说你不止一条神经，你有多个神经同时受到损伤。比如说如果我们手的神经受到损伤是网管综合症，然后我们腿部的神经比如说腓肿神经受到损伤，那么它可以两个同时发生，不是只是一个，所以叫做多发性单神经病变。最后提到的这个呢是广泛性对称竹突感官和运动多发性神经病变。这个词汇听起来挺复杂的，但是实际上呢，它就是表示这个不仅仅是你的神经的感知的神经受到影响，你的运动神经也同时受到影响，那么很多时候就表示你的力量也会受到影响。So this one, I'm basically showing a picture for peripheral neuropathy, so what can cause peripheral neuropathy in lupus? Basically, we know lupus is a disease of inflammation to the blood vessels. And when you have inflammation to the blood vessels, you reduce the blood flow. When you reduce the blood flow, then you affect it, and the blood supplied for the nerves, then cause the nerve damage. 这是一个图像，比较直观的给大家显示一下周边性神经疾病是什么引起的。通常我们知道红斑狼疮里面它的血管是受到损伤的，因为它血管有发炎，所以呢它可能会引起血流量的减少。那么血流量减少呢，就会引起这个血管所去营养的神经，那么神经就会受损。So we talk about the multiple mono-neuropathies means like you have different nerves being involved in your body. So example one is carpal tunnel syndrome. Carpal tunnel syndrome is actually very common. You do not need to have lupus to have it. For example, if you type a lot, if you're doing a lot of things, you need to bend your wrists a lot, you could develop carpal tunnel syndrome. So this basically, as the graph showing, it affects the first 3 digits plus half the 4th digits. It's majorly affect the sensation, cause numbness and tingling. 所以这里呢，我给大家显示的呢是这个网管综合症。网管综合症就是我们刚刚说到的其中的一条神经受到损伤。那么这个网管综合症受到的神经损伤呢，通常是我们叫做正中神经损伤，是在你的就是手腕的附近。那么它引起的区域呢，主要是你头3个手指加上一半的第4个手指的疼痛和麻木的区域。So let's talk about diagnosis of the neuropathy in lupus. So what do we do as a neurologist? Okay, so first of all, we need to have a very good clinical history taking, right? We need to know your symptoms of your numbness, tingling, weakness, or pain. Where are they? In the feet, in your hands? So the history taking is very important. Then the part of the neurological exam that can evaluate the sensory dysfunction will include touch, pinprick, and temperature. Touch, just any kind of soft touch to soft things. Pinprick means, your sensation to something very sharp. Temperature is basically cold or hot. Then we can also test your muscle strength to see if you have any kind of weakness in your body. And then we check your reflexes and how you walk. So nerve conduction study is a very, very important method to diagnosis neuropathy, if not this, most important objective methods to diagnose this. So basically the electromyograph with the nerve conduction part, they can identify nerve damage and its location. And for lupus, as we talked about before, it's a lens-dependent axonal sensory neuropathy. Another thing we could use will be nerve biopsy or skin biopsy. So nerve biopsy and skin biopsy are not necessary because they are invasive. So most people do not have a cut, in your skin, to do this type of test. But in certain cases, they are very helpful to diagnose. For example, for nerve biopsy, you can see a lot of inflammatory infiltrates. Do not worry about the medical terminology here. It's basically just a summary of the most common inflammatory cells you see. So you just need to remember, if you see a lot of inflammatory infiltrates, it basically shows it's autoimmune pathology. So that's, the nerve damage is likely caused by lupus. Then you can do skin biopsy. Skin biopsy is very, very useful for small fiber neuropathy because it can show a decreased density of the epidermal nerve fibers. And it's it's a much simpler procedure compared to the nerve biopsy, but both can be very useful in certain cases. 所以呢，现在呢，我们讲讲这个诊断红斑狼疮的那个神经受损的诊断呢。首先我们要检查你的神经系统，对不对？我们要评估你的历史，比如说你是什么地方麻木、刺痛，或者哪里觉得没力，哪里觉得疼痛，这些症状是非常的重要，可以帮助到整个诊断。然后呢，我们需要检查你的触觉。 你对针刺的感觉、对温度的感觉的敏感性，以及你的肌肉的力量、你的反射和你走路的样子。神经传导和肌电图检测呢，可能是说是最objective、最比较有用的、最客观的一个诊断的测试。那么这个呢，可以用于识别神经损伤的位置。较为常见的在 lupus 里面呢，是一种与长度相关的竹突型的那个神经病变。有的时候呢，我们也需要进行神经活检或者是皮肤的活检，这个不是必要的，因为呢，这个就说这些测试呢，这些活检呢，毕竟是有侵入性的，所以很多病人或者大家都对有侵入性的一些检查比较抗拒，所以这个并不是必须的。但是呢，它在有些时候呢，比如说你神经测试这些，还有你的临床的这些history，并不能很好的帮助你的这个诊断的时候，那么神经测试或者是皮肤活检的测试呢，就非常的有用了。这里呢有一些比较那个医学的术语，但是实际上大家只要记住的就是说，当你神经活检的时候，如果你看到有一些发炎的渗透性的细胞，那多数呢就表示这是一个免疫性的发病，那么就可能是这个红斑狼疮引起的这个周围神经病变。然后呢，如果你做那个皮肤测试的时候呢，如果你测出了你的表皮的神经纤维的密度有减少呢，就表示呢你有小纤维的神经病变。所以这都是很好的诊断的方法，就是在你不能用神经测试诊断的时候。So this one, I just like to show you some, nerve conduction study pictures. So if you look at the top one, which is a normal nerve conduction study, the second one is abnormal. So I don't know if any of you guys notice the difference. So I'm going to tell you here. I mean, I would like to ask you, but I guess our time is not allowed. So let me just directly tell you. If you look at the spot number 1, so basically that's what we call latency. So it's the time takes for the nerve fibers to respond to a stimulus. So you can see on the top, the 1 is very closer to the beginning, and the bottom, the 1 is further away. So it means it takes much longer time for the nerve to respond to the stimulus. So that's why it's abnormal. The second one you can look at is number 2. So number 2, you see there's a height. This is our amplitude. So the height compared to the baseline, you can see the amplitude of the 2 to the baseline compared to the bottom one, 2 to the baseline. It's much taller. So they have a higher amplitude compared to the abnormal one. So delayed latency, decreased amplitude can all indicate there is a nerve damage. So this is a sural nerve. Sural nerve is the most common sensory nerve in our feet that we use for the nerve study. 所以这个呢，就是给大家显示一下神经测试图。第一个呢是正常的，下面一个是不正常的。所以大家可以看到，第一图的第一个位置呢，就说它和第二图的第二个位置，就说这个时间上面它在它的前面，所以呢就是表示你的神经受到刺激之后，它形成的这个反应，这个时间段就是比较短，而不正常这个呢，这个时间段就比较长。第二个我们要看的呢，就是第二个这个呢是一个波幅，是一个幅度，所以我们看到2和它的那个 baseline 的这个距离的话，比下面这个图明显要高一些。所以就说你的时间的神经的对那个你的刺激的反应的时间和你这个神经所产生的幅度，都是可以就是让我们确定你这条神经有没有受到损伤。然后这个 sural nerve， 这个是一个 sural nerve， 是我们身体里面最常见的脚的一个感知的神经。So the next one, I'm showing you the, basically the nerve biopsies. So it's a pathology graph just to show you. So you can see the arrow indicates a blood vessel, and you can see all those bluish, purplish dots. Those are all inflammatory cells. So we can see all the inflammatory cells are attacking the blood vessels that cause neuropathy, and of course also cause the other, problems, blood vessel problems in lupus. 这个图呢是给大家显示一个神经的那个活检的片子。这里呢，这条那个这个箭头所指向的呢是我们的血管。因为我们知道红斑狼疮就是血管受到损伤，这些紫蓝色的这些小点呢就是我们的就是发炎的细胞，所以我们可以看见这条血管被所有这些发炎细胞所笼罩着，在侵犯它，所以呢这会造成了血管受到损伤，然后呢神经会受到损伤。So the next one, let's talk about the treatment. So for the neuropathy, what's our treatment goal? So basically, our goal is to reduce inflammation, relieve pain, and prevent further nerve damage. So the treatment, we're going to talk about pharmacological treatment and the non-pharmacological treatment. So pharmacological treatment, including corticosteroids. So basically, those can reduce the inflammation. And then we can use our immunosuppressive therapy, like cyclosporine, azathioprine. Those all suppress your immune system to attack itself, to attack the nerves. And we can also use monoclonal antibodies, rituximab, to basically also help with the inflammation. IVIG, which is the intravenous immunoglobulin therapy, this is very helpful for the demyelinating neuropathy. Remember, we talk about two types of neuropathy in lupus. Axonal neuropathy is more common. Demyelinating is less common. But once you have demyelinating neuropathy, IVIG is a very effective treatment for the neuropathy. So, of course, we have to talk about neuropathic pain medications. So they have gabapentin, pregabalin, topiramate, Cymbalta, and others. There are local anesthesias. For example, you can use the lidocaine cream, you can use a patch. We also have over-the-counter pain medication for mild pain. For example, you just have a little pain, you can use a little Tylenol, or you can use a little Motrin. But be very careful with NSAIDs, with Motrin, this kind of anti-inflammatory, because don't forget, lupus also affects your kidney. If you're taking too much anti-inflammatory medications, that's not good for your kidney. 下面呢，我们讲一讲这个红斑狼疮引起的神经周围疾病的治疗。治疗呢，我们有目标，就是要减少炎症，要缓解疼痛，然后呢，需要进一步的预防神经的损伤。我们分为药物治疗和非药物性治疗。药物治疗呢，就包括糖皮质激素，可以减少炎症；免疫抑制的一些药物，可以抑制免疫系统对这个自身神经的攻击。也有单克隆的抗体，可以调节你的异常的免疫反应。然后呢，我们有这个静脉注射与免疫球蛋白，就是 IVIG，这个呢对那个脱壳性神经病变呢是非常有效果的。然后呢，神经的一些疼痛止痛的药物呢，就是包括列出来的有很多种不同的，有不同的用处。比如说 Cymbalta 最后一种杜罗西丁，这个呢就是对小纤维神经受损的那个周围神经疾病非常有帮助。还有呢，我们可以用一些局部的麻醉的药物，比如说你一些贴片啊，你一些那个乳膏啊，可以减轻局部的疼痛。然后非处方性的药呢，比如说 Tylenol，可以缓解轻微的疼痛。这里呢特别要提醒大家，因为有另外一些药物，也是非处方性的，像什么 Motrin 啊这种可以止痛，而且它的止痛功能呢可能比 Tylenol 更好，但是它有一个很大的问题，就是它通常会，如果你用的太多，会影响你的肾脏，而我们知道红斑狼疮对肾脏是非常不友好的，所以呢建议这种 NSAIDs、Motrin 这种东西呢还是要少用。So next treatment, we're going to talk about the non-pharmacological treatment. So this includes physical therapy, occupational therapy. Occupational therapy is majorly talk about hand, your arms. And we can do some activity modification. For example, if you already have a carpal tunnel syndrome, your median nerve already affected. So you got to minimize, stress to that affected nerve. For example, you should not bend your wrist too much, too often, too frequent. So you can get the nerve, minimize the stress, so the nerve can have a chance to heal on its own. And we can use heat therapy. So, heat is a very, very good therapy, like the heating pads. You can relieve your joint pain, for example, shoulder pain, your stiffness, very effective. Rest and exercise. So we recommend no impact exercise. So what are the no impact exercise? I'm going to tell you later. And stress management, of course, if you feel always anxious, you feel like depressed, it's definitely not good for, the disease at all. So stress management is very important. Do something you like, listen to music, play instrument, read some, books you like. Those are all stress management. And anti-inflammatory diet. So here we go. We are, especially I think Asian, Chinese, we focus on diet a lot. So what are the diet that actually help with lupus patient? So here are some lists like fruits, vegetables, fatty fish, nuts and seeds, whole grains. So you really need to avoid highly processed foods. If you like McDonald's, stop that. That's not good for you. Not just for lupus, actually, for everything. OK， 现在呢，我们讲讲非药物的治疗。非药物的治疗呢，包括物理治疗。物理治疗呢，通常是全身性的；职业治疗呢，通常是更着重于手的理疗。我们要进行一些活动的调整，比如说我们要减少一些对神经的压力。我刚刚举的例子呢，就是比如说腕管综合症，你腕管综合症，你的正中神经在手腕这里已经受到压迫了。那么你就不能老是做弯手腕的动作，那你就应该经常就是 stretch your hand， 就是那个不要弯，而是要向上伸展。这样的话，就是会让这个神经呢有休息的机会。还有呢，我们有那种护腕，是晚上睡觉的时候可以戴的，因为我们不知道晚上你睡觉睡成什么样子。有些人呢喜欢这样弯着手腕睡，这样是非常不好的。所以呢，带着你的那个护腕呢，你就不能弯你的手腕，那么你的神经在晚上这个时间呢，就可以得到休息，然后呢，可以自行的修复一些。还有热疗法，热疗法是非常有用的，对于疼痛啊，对僵硬啊，就说你可以买一个插电的那种pad heating pad，是非常好的。还有就是休息与锻炼，我们建议一些低强度的运动，而不是高强度的运动，然后要注意休息。压力的管理非常重要，因为我们都知道，当我们心情不好的时候、抑郁的时候、焦虑的时候，其实对整个疾病是不良影响的。所以呢，那么我们做一些自己喜欢做的事情，听听歌呀，弹弹琴啊，或者是看你喜欢的书啊，任何关于压力的管理，对这个都非常有用。最后要提到的呢，是我们的饮食，我们需要吃的是抗炎的饮食、抗炎症的饮食。这些呢，就包括水果、蔬菜，富含脂肪的鱼类、坚果、种子、全谷物，要避免高度加工的食品，像什么你去那个麦当劳去吃的那些东西就非常的不健康，大家应该避免。Okay, so I told you we're going to talk about the no impact exercise to try. So there are the 5 exercises you can try. Cycling is very good. You can do bicycle outside in the park. You can also do the stationary cycling. Swimming, I really think swimming is like the best exercise because it involves your whole body. It's a very exercise. If you like swimming, just, you should do more. Pilates and yoga, they are all like stretching type of exercise that can help your body with stiffness and pain. If really you have limitations of your activities, of your body function, you can just do walk. I will say 30 minutes of walk will definitely, if you can do every day, it will definitely help you. 我们刚刚讲到那个低强度的运动推荐，下面呢，我推荐这5种。骑自行车，你可以到户外去骑自行车，也可以骑那种就是不动的固定的那个自行车。还有就是游泳，游泳是一个非常好的运动，因为它是全身的运动，所以我是非常推荐的。普拉提和瑜伽呢，这个呢就是对你伸展你的身体，放松你的肌肉，让你僵硬的地方不要那么僵硬，都是有帮助的。如果你的身体状况实在是不好，那么你可以考虑就是散步走路。其实如果你每天能够走30分钟的路的话，这 对你的那个整个的身体，还有对你的周围神经系统的这个损伤，都是一个很大的帮助。So we're going to talk about the lupus diet. I mentioned before what type of diet you should eat more, what of diet you should avoid. So like I said, fish, walnuts, fruit, veggies, whole grains, those are very good for you. So try to eat those more. And food to avoid, garlic, alfalfa sprouts. So you may think, didn't we say garlic is very good, especially for Asian Chinese people? We say garlic can improve your immune system. Unfortunately, garlic and alfalfa sprouts, they're not good for lupus patient because imagine lupus is autoimmune disease. It's your immune system already overactive. If you use garlic to boost the active, the become more active of your immune system, so it will make your lupus worse. So you may have lupus flares. That's why for lupus patient, we actually should avoid garlic. Sugar is bad for everything. We know that, not just for lupus, but because sugar can really cause inflammation. When you eat too much sugar, you make the inflammation in your body even worse. So for lupus patients, you already have enough inflammation going on. You definitely do not want to add more on it. Processed foods, like I mentioned, like McDonald's, hamburgers, the French fries, those are not good at all. The same reason that will increase more inflammation to your body. 现在呢，我们讲讲红斑狼疮的饮食。我们建议的食物呢，就是像鱼类的，特别是三文鱼，还有什么坚果呀、种子啊、水果啊、蔬菜呀、全谷物的，像什么全麦呀、糙米呀，这些都很好。不易的食物呢，包括大蒜、木须。大蒜和木须呢，通常我们亚洲人，特别是中国人，说大蒜对免疫系统是非常好的，它可以 boost 你的免疫系统，就是可以让你的免疫系统增强。但是因为红斑狼疮本来就是一个免疫系统过剩的一个疾病，那么你再去增强你的免疫系统，那当然就会产生不好的影响。那你免疫系统更过剩的话，那会让你的那个 lupus 的症状更加加剧。所以我们建议大家要避免大蒜、木须这种东西。糖呢，大家其实都知道是不健康的，不仅仅是对那个红斑狼疮，对很多疾病都不健康。因为糖是可以让那个你的发炎炎症更加加剧的。同样，加工食品也是让你的炎症变得更严重，所以这些食物是应该避免的。Thank you for your attention, and I hope everybody learned something from this seminar.